Bismillahirrahmanirrahim. The next important type of gastritis is autoimmune gastritis, and this autoimmune gastritis accounts for less than 10% of the total cases of gastritis. If we compare it with H. pylori associated gastritis, in which there was involvement of the antral area, in autoimmune gastritis, the antral area it is spared, that is not involved. In fact, the body of the stomach that is involved. And if we talk about the level of gastrin, the level of gastrin that was normal or decreased in case of H. pylori associated gastritis, while in autoimmune gastritis there is hypergastrinemia. So these are the two important differences of autoimmune gastritis from H. pylori gastritis. Towards the end of the topic, we'll be able to know the various differences between the two forms of the gastritis, and it is a very important university question that is asked in SAQ exam. Autoimmune gastritis, it is characterized by development of the antibodies which are formed against the parietal cells and the intrinsic factors, and these antibodies they can be detected in the serum, and they can also be detected in the gastric secretion. There is decreased secretion of pepsinogen 1, and endocrine cell hyperplasia is associated with this autoimmune gastritis. When there are antibodies against intrinsic factor, it will lead to deficiency of B12, and there is decreased or defective acid secretion that is called as achlorhydria. So these are the 5 important characteristics of autoimmune gastritis. Short essay question can be asked of about 2.5 marks. Write the important or enlist the important characteristics of autoimmune gastritis. So just number them 1, 2, 3, 4, 5, and you can write these 5 lines. This is an important picture. This is an important picture regarding the pathogenesis of this autoimmune gastritis, and as you know that it is associated with the antibodies against the parietal cells which result in the loss of these parietal cells. And the parietal cells, as you know, they are responsible, they are mandatory for the secretion of the acids and acid and intrinsic factor. This is the reason that there is defective gastric acid secretion, achlorhydria, and there is B12 deficiency because intrinsic factor that is also not secreted. When the acid that is absent, it will result in secretion of the gastrin, and this increased gastrin secretion it will result in hypergastrinemia, that is a contrasting feature from H. pylori associated gastritis. Similarly, twice already I have mentioned that the lack of that intrinsic factor it will lead to deficiency of B12, and when there is B12 deficiency, it will result in megaloblastic anemia. Megaloblastic anemia has a specific form that is called as pernicious anemia, and that pernicious anemia it is due to the antibodies against the intrinsic factor. So there are other causes of B12 deficiency anemia. Pernicious anemia is one of them. When B12 deficiency is specifically related to the defective secretion of this intrinsic factor or antibodies against the intrinsic factor, it will be called as pernicious anemia. Similarly, in the previous slide, when we discussed the various characteristics, or when we list the various characteristics, there was a feature that was that there will be reduced secretion or the reduced concentration of the pepsinogen 1, and it results from destruction of the chief cells. So two types of the cells they are lost: parietal cells are lost and chief cells are lost. Parietal cells they are responsible for the acid secretion and the intrinsic factor secretion, while the chief cells they are reduced. They are responsible for the secretion of pepsinogen 1. So the secretion or the concentration of pepsinogen 1 that will also be reduced. Two important features that were seen in H. pylori infection, that they can H. pylori gastritis, that in infection it can cause gastric atrophy and hypochlorhydria, while there is no association of pernicious anemia in case of H. pylori infection. Pernicious anemia is reserved for this autoimmune gastritis. So, what are the characteristics of these autoantibodies? Basically, these are the CD4 positive cells which are directed against the parietal cell component, and one of the very important parietal cell component that is seen in this slide is hydrogen potassium ATPase, and this is the main agent or the main receptor, you can say, or the main component that is destroyed by these autoantibodies. Similarly, these autoantibodies, they are also present against the intrinsic factor in most of the patient, in about 80% of the population who are affected with autoimmune gastritis. This is the morphology. Morphology will be the same. The features, the microscopic feature will not be that much different from H. pylori gastritis. Yes, you will not find the spiral shaped or curve shaped microorganisms in the lumen of the glands. There is diffuse mucosal damage. Basically, the main acid producing glands, the main acid producing cells which are present in the body and fundus, they will be damaged. The antral area will be spared. There may be neutrophilic infiltrate, there may be infiltrate of other inflammatory cells like lymphocytes, plasma cells and macrophages. And as for H. pylori gastritis, as I told you, that the inflammation can be so much severe that it can lead to formation of the lymphoid follicles. So lymphoid aggregates, they can also be formed in this case, in the case of autoimmune gastritis. One important feature to note is the atrophy of the mucosa, the atrophy of the chief cells and the parietal cells. Sometimes few cells, they are atrophic, the neighboring cells, they are normal. So these alternating area of normal mucosa along with the atrophic mucosa, it can give rise to the appearance by making numerous small polyps, and these are a common feature of this autoimmune gastritis. Endocrine cell hyperplasia, that can be seen, or that is an important characteristic of this autoimmune gastritis. Endocrine cell hyperplasia, it occurs basically due to hypergastrinemia. Hypergastrinemia can cause the endocrine cells, especially present in the fundus and body, and when the endocrine cells, they are stimulated, they will become hyperplastic. Clinical features. Clinical feature, basically autoimmune gastritis, it is usually diagnosed in old age people more than 60 years of age, and it can have association with other autoimmune diseases like hypoparathyroidism, diabetes mellitus. It has association with thyroiditis. Then Graves disease is an important disease that come in association with this autoimmune gastritis. Graves disease is again an autoimmune disease that affects the thyroid gland. So it has very strong association with various other autoimmune diseases. The next point is about its genetic predisposition. मोनोजाइगोटिक ट्विंस की अगर बात कर लें, और तो उनमें it is more common. If one is being affected by the autoimmune gastritis, then there are high chances that the second twin may also become affected. And so again, genetic predisposition along with the few associated autoimmune conditions which I already mentioned. So these are the two important factors which can lead to the development of this autoimmune disease. Similarly, if a person in a family is suffering from autoimmune gastritis, there are chances of that in his or her immediate family members, someone may develop signs and symptoms of this autoimmune gastritis. Vitamin deficiency, B12 deficiency is very important, and that is associated with autoimmune gastritis. And when there are deficiency, and when there is deficiency of this vitamin B12, it will lead to various neurological symptoms. It will lead to tingling sensation in the hands, and in the feet. Basically, they are called as the neuropathic changes. The neuropathies which are associated with anemia, they give a classical hint towards the diagnosis of B12. So these are the important differences between H. pylori associated gastritis and autoimmune gastritis. When we talk about the location, H. pylori is present in the antrum, and autoimmune it affects the body. Acid production is increased in H. pylori while it is decreased in autoimmune. Acid production can even be decreased in H. pylori, but not that much decreased. Generally speaking, it is increased in H. pylori associated gastritis. Gastrin secretion is always increased in autoimmune, while it may remain normal or it may decrease in the H. pylori associated gastritis. When we talk about the serology, antibodies to H. pylori will be seen in case of H. pylori gastritis, while in case of autoimmune you can find antibodies against the parietal cells, against hydrogen potassium ATPase, and against the intrinsic factors. Patient can develop various complications, especially when we talk about H. pylori. Patient can develop peptic ulcer and adenocarcinoma, while in case of autoimmune gastritis, along with adenocarcinoma, there may occur the atrophy of the oxyntic mucosa. The patient may develop pernicious anemia. H. pylori is associated with low socioeconomic status and the poverty, while autoimmune gastritis, it is associated with various other autoimmune conditions, for example, thyroiditis, Graves' disease, diabetes mellitus. Similarly, one other important feature is B12 level or anemia. Anemia can occur in H. pylori associated gastritis, but that will not be due to deficiency of B12. Well, in autoimmune gastritis, anemia can occur, and that anemia is due to vitamin B12 deficiency. So these are the important differences between H. pylori and the autoimmune gastritis. A very important question. You people should know these important points, and these are mentioned in the Robbins. So in the next lecture, we'll talk about the various complications of the chronic gastritis, starting from the peptic ulcer disease. And this is another slide showing a few unusual forms of the gastritis: eosinophilic, lymphocytic, and granulomatous gastritis. Eosinophilic gastritis can occur due to various allergic disorders. For example, it may occur due to systemic sclerosis, parasitic infestation, or it may occur due to cow milk protein allergy. Lymphocytic gastritis, it can appear due to some other causes other than H. pylori. Other bacteria may result in the development of this lymphocytic gastritis. When we talk about the granulomatous gastritis, it can be associated with the TB, it can be associated with the Crohn's disease, and you will find numerous epithelioid granulomas in case of granulomatous gastritis.